Hi everyone. It is day 15 of the video challenge, and you can tell I'm still at work and swamped in paperwork. So I figured I would do a video where I looked a little bit more presentable. I looked at my last two videos and I was looking pretty rough. So I figured I would do this before the end of my day. So today, what I want to talk about is primary prevention and cancer screening. I was really kind of reflecting on my day and want to kind of talk about the things that I see on a daily basis. And one of the most common things that I see in my practice when I'm asking people about their overall health is that people don't necessarily know what their family history, medical history is. They don't know if there's cancer that runs in the family. They don't know if there's diabetes or heart attacks or strokes. Or high blood pressure or high cholesterol. They don't know. And so they don't really know if their parents are on medications or if their siblings are on medications. And that's really important for your primary care provider, whether that's a nurse practitioner like me or whether it's your family doctor, to be able to guide how we screen you to provide early detection for diabetes and high blood pressure and high cholesterol and all of these things, because generally these things don't make you feel unwell, right? So, with high blood pressure, we really do call it the silent killer because you don't necessarily feel unwell. So it's really important to be going in and talking with your family doctor or your nurse practitioner, but also knowing what your family history is so that we can guide our screening. The other thing that I noticed is that lots of people don't have their regular cancer screening up to date. So women are not coming in for their PAPs. They're not getting their mammograms done. They're not doing their stool sampling for colorectal cancer. Men, same thing, not getting their stools checked for colorectal cancer. And, there's a lot of fear with that. A lot of people say, every time I come in to see you, you tell me there's something wrong and you give me a fistful of pills, right? And so they want to avoid me. But this screening is really important. Especially pap smears. I had mine last week. I know, women, it is not nice. I don't know who did it. It's embarrassing. But it's a really important thing that we need to do for our health. Pap smears, we do them every 3 years until the age of 69. If your pap smears have been normal, if they're abnormal, certainly the frequency of that changes. With mammography, we start that at the age of 50. If you have no prior family history of breast cancer. And generally those are done every 2 years, but also that changes depending on the imaging of your breasts and if there are any concerns. And same with the stool sampling kits. We start that at the age of 50 if you don't have a family history, and we do that every 2 years. If you do have a family history, so a first degree relative, meaning that you either have a mother or a father or a sibling that has colorectal cancer or breast cancer, we start screening you 5 years prior to their diagnosis. So knowing the age of their diagnosis is really important. So that, we can do early detection and we can do, get treatment if we need to quickly and appropriately. So I encourage people to really go. We don't necessarily do annual physicals per se on people, but really, you need to be popping into your provider every 2 to 3 years, more frequently once you get over the age of 50, just to be able to make sure all your screening's up to date, and they'll let you know the frequency in which you need to come and see us. Or see them. So that's, that's important. And the other thing we do is over the age of 65, we really encourage bone mineral density screening for osteoporosis. So that's brittle bones. And really an overall recommendation for general wellness is, obviously, having a pretty clean diet, doing some sort of physical activity. We know both of those things will help prevent dementia. It will improve our moods and just overall general health. But we also, I really strongly suggest sunscreens. We know that the rays of the sun do cause cancer, and so we really do not want people baking out in the sun It puts them at very high risk for skin cancer. So really putting sunscreen on, wearing a hat outside, and getting enough calcium and vitamin D. So in women, kind of over the age, we stop making our bone mass kind of over the age of 30. And so we really do need to have exercise that, weight-bearing exercise is what strengthens the bones, but we also want to make sure we have enough calcium and vitamin D. And the recommendations really for vitamin D is that in Canada, we do not get enough sunlight, and most people are vitamin D deficient. And so really in the wintertime, we should be getting 2,000 international units a day and 1,000 international units a day in the summer. And then calcium, is really a combination between diet and supplement. So, I don't encourage supplements if you're getting a very high calcium rich diet through green leafy vegetables and, salmon and dairy. You can go online and use a calcium calculator because you can get too much calcium, and calcium can harden the arteries. So we really want to be careful. We don't want people to be on any more than 1,300 milligrams between their diet and their supplement. And the last thing that I want to talk about, which is really, really important, and I come into contact with this almost on a daily basis because I do a lot of care in the elderly, is really talking to your family members about your end of life wishes. So, and what do I mean by that? Having discussions with your family members, your kids, or your partner, your husband, about, whether you want to donate your organs if there was, an accident. And the other is whether you want your heart restarted if it stops. So do you want CPR? And do you want to be on life support? And certainly that this discussion is much more complicated. And as a healthcare provider, I give a better explanation and understanding of that. But really having conversations early on when you're well is important. And just always touching base about those conversations regularly, so that when somebody gets really sick, everybody's aware what somebody's wishes are. Because I come across this almost on a daily basis, where people haven't had these discussions and then they come and see me and they're quite sick, and I have to have these conversations, and they're difficult. These are not easy conversations to have, but if we make this mainstream, if we make this a comfortable thing that starts many years in advance, then we can have a little bit of humor around it, and really kind of explore people's likes and dislikes and what they want, early on, and it doesn't become this really awkward, uncomfortable conversation in a crisis. So, my husband's very much aware that I would, be happy to be an organ donor. He's very much aware that I do not want life support, and I only want treatment for reversible causes. So things that are gonna allow me to have quality of life. I do not want to be kept alive if I have no quality of life, and I've been very clear about that. And so he knows that those are my wishes. So yeah, so I encourage you to have conversations about your end of life wishes. And the other thing I ask people is just, if you're, over the age of 50 or over the age of 60, have you thought about who your power of attorney for health and finance would be? So generally, if people don't have somebody identified, it all automatically goes to your spouse to make those decisions on your behalf. And if your spouse is not able to do that, it goes to the eldest child. And so if you don't want that, then, really appointing someone. And it's important, that in a will, if you're going to appoint a power of attorney, you appoint somebody who, for health, that is different than your finance. We don't want the same person doing that, because it's really difficult to kind of manage both of those things. And we also see a lot of, unfortunately, kind of elder abuse. And so, so it just prevents that, the muddiness of what that could be for families. So, tough conversations, but I really encourage you to do that. So in the comments below, let me know if your primary healthcare stuff is up to date, or if you need to go in and see your primary care provider. But also, have you had conversations with your family about what your wishes are for end of life? I know that I have, and I'm very young and I'm planning to be here for a really long time, but I think it's really important to have those conversations. So there's, we don't need to wait until there's a crisis. So yeah, let me know. Let me know where you're at in that journey. And if you need more information about what that really means, or if you need more information on how do you have that conversation with your family, by all means reach out to me. It's something I'm very comfortable with. I do it almost on a daily basis. So if you ever need help, reach out. So have a nice evening. I'm going to get back to my paperwork, and I will see you tomorrow. Take care. Bye.